right, so what we'd like to start talking about is how we actually produce these guides. It starts by you appointing to the office and us taking an intraoral scan of your mouth. We're avoiding the use of actual impression material and using an intraoral scanner which has cameras that is taking thousands of little pictures of all of the different structures in your mouth. You'll then have a CT scan taken in the office, and this will take an image of the bone and the surrounding structures. We put these two images together in our software and we're able to overlay them to get a virtual image of your exact copy of your mouth. And from this, we can start fabricating the guide. This is where a lot of the software and the improvements in software comes in. We're able to put virtual teeth in, we're able to put virtual implants in, and we can play with the angles to see how they will connect with the teeth, how your bite will look, and how the aesthetics will look. And we can modify it as such. Once we feel that this is a good representation of what we feel would be the best for you, we can even share this with your general dentist or restorative doctor so that they can see what we're thinking from an implant placement standpoint and give us any changes that fits into what they're looking at from a workflow standpoint. With all these things together, we can now fabricate the guide, and we've done this all virtually without you having to be in the office or without taking up too much of your valuable time. Designing the guide involves the use of very specific CAD/CAM software. This software was taken from other industries and tailored to dentistry, where we actually are able to design every little aspect of what we plan to be your implant restoration, where the implant would go, and also how we want to fabricate the guide. What's interesting about this software is it takes all these things into account, and now with the use of AI, we can actually take hundreds of thousands of information data sets and really utilize that to get as precise in our implant placement, but also what will fit your bite patterns. So we're really trying to get to a point where we're doing what we term as top-down dentistry. What that means is we want to see what functions first and then place the implants instead of the other way around. Traditional implant placement used to rely on the quality of the bone and the availability of the bone for placement, and that led to a lot of aesthetic and functional challenges when it came time to make the crowns. With this approach, we're doing it in what would be most similar to a blueprint on a house, where we can see the entire plan and then follow that plan for the placement so that we're not running into any of the aesthetic and functional challenges that used to be met. The software is ever evolving, and what's great about that is we're just getting better and better with our precision and our design, and it's just making for a better overall patient experience in both the surgical aspect and also in the restorative aspect. And ultimately that gets you to the crown much faster and gets you functioning a lot quicker. So how do we actually print these surgical guides? Well, they've come out with dental specific 3D printers that are calibrated within to at the very least 100 microns, but most commonly 50 microns of accuracy, which, to give you some perspective, 50 microns is about the visual acuity of a human hair. So we're getting very accurate. These printers are calibrated weekly with special calibration devices, so we know that what we're printing matches what we designed in our software. On top of that, they've made dental specific resins, which are biocompatible, have a low volume of shrinkage, which is important for accuracy, and that are also rigid enough to support the function of serving as a surgical guide. This is also true for a lot of the other applications of 3D printing in dentistry, such as making temporary crowns, making dentures, making partial dentures, and the dental stone models that we used to have to take with impressions can now be 3D printed as well. So all of these materials together can be utilized in different ways so that we can fabricate each aspect of your dental procedure and get you to the crown much quicker. The surgical guides, once they've been printed, are not just immediately inserted into the mouth. It goes through a post-printing process. And this process is important to ensure biocompatibility and to make sure that these guides are accurate. The first step is to make sure that they're washed of any extra resin, so nothing extra will be going in your mouth. They're then cured, and what this does is locks in the material to prevent any leakage of any material. It also helps to lock in the positions and what we call our dental sleeves. These sleeves are what allow us to place different guides into the actual surgical guide for our drilling of the dental implant so that there's no movement from side to side or up and down. This is where a lot of the accuracy comes from in the guided implant placement. And we also have specific implant kits which fit into these guides. These are all designed, calibrated, and come from the manufacturers so that we know that we're not getting any extra data that could possibly cause the implant placement to be imprecise.